Dear students, welcome back. In the previous session, we have seen the scapulohumeral rhythm part 1. Now we are going to see the scapulohumeral rhythm part 2. In the part 1, the contributions for the scapulohumeral rhythm is the scapulothoracic as well as the glenohumeral contributions. Here, in this second part, the contributions are the sternoclavicular contributions and acromioclavicular contributions. So, as we know that scapulohumeral rhythm involves the combined action of the sternoclavicular and acromioclavicular joint as well as the scapulothoracic joint and the glenohumeral joints. Okay. So this is because the scapulothoracic joint is a part of a closed kinematic chain, isn't it? This scapulothoracic joint is connected at the AC joint as well as SC joint, forms a closed kinematic chain. So any movement occurs in the scapulothoracic joint also causes some movements in the other two joints. Okay, that is the closed kinematic chain. So, because of that reason, the movements is taking place in the scapulothoracic region also causes some contribution during this arm elevation, whether it may be flexion or abduction. There are some movements are also taking place in the acromioclavicular joint as well as the sternoclavicular joint. Okay. So, for the maximum range of elevation, the scapula is going to rotate 60 degrees of arc. That is called 60 degrees arc of upward rotation is taking place by the scapula on the thorax. And for that 60 degrees of motion, the movements are also contributed in the SC joint and AC joint along with the scapula will be taking place. Okay. So, and these are produced by such kind of movements are produced by the force couple of the trapezius. So, as we know that the trapezius is having three fibers, upper fibers, middle fibers as well as the lower fibers. And next muscle is the serratus anterior muscle. So serratus anterior muscle is attached on the anterior aspect of the medial border of the scapula, isn't it? These two muscles are the only muscles capable of upwardly rotating the scapula. Okay, so that means here in this sternoclavicular and acromioclavicular contributions, so the scapula is rotating a maximum arc of upward rotation, that is 60 degrees. Out of 60 degrees, the sternoclavicular joint will involve to certain degree of the scapular rotation, and a certain degree of further scapular rotation is taken over by the acromioclavicular joint. So both the joints help to rotate the scapula to its maximum range. Now how it is going to take place, now we will see. It occurs in two phases. One is the phase 1 and phase 2. In the phase 1, what will happen is the upper and lower portions of the trapezius. That means here the upper and lower portions of the trapezius combined with the upper and lower portions of the serratus anterior muscle to produce an upward scapular rotation. Okay. So although this motion would most likely occur at the acromioclavicular joint. Okay. The tension in the conoid and the trapezoid, that is the coracoclavicular ligaments, prevents this acromioclavicular movement. So upward rotation of the scapula at the acromioclavicular joint would result in movement of the coracoid process of the scapula inferiorly. So because of the attachment of the coracoclavicular ligament, it limits the movement of the acromioclavicular joint, but the forces which are obtained by these muscles causes the coracoid process, which is present on the anterior aspect of the scapula, will move inferiorly. Okay, so the coracoid process is tied to the clavicle by the coracoclavicular ligament, and the movement of the scapula is prevented because of this coracoclavicular ligament. The upward rotatory force on the scapula continuous. So that is the coracoclavicular ligament which limits the motion there. But still the rotation is going to take place here. How it takes place means the upward rotatory force on the scapula continuous. However, as the trapezius and serratus contract, these muscles produces movement at the next available joint, that is the sternoclavicular joint. So this sternoclavicular joint allows further rotation of the scapula. Okay, next, the pull of the muscles on the scapula, that is the direct pull of the upper trapezius on the lateral clavicle force causes elevation of the clavicle, So during this elevation of clavicle, so how elevation of the clavicle occurs at the SC joint. So how this axis formed at the SC joint, an axis, a line which is drawn towards the axis at the center of the sternoclavicular joint to the base of the root of the spinous process of the scapula. So at this forms the axis of rotation for which scapulothoracic joint. So it forms the axis of rotation. So which causes some rotation of the scapula, that is scapular upward rotation causes at this axis. So during this motion, there is no movement taking place at the acromioclavicular joint. So this thing moves as it is. So that means there is no movement taking place at the AC joint. So the acromioclavicular joint, which is attached to the scapula and the lateral end of the clavicle, will move as a segment. So this will move as a segment, as there is no motion is taking place at this joint. Only the movement is taking place at the SC joint only. For this, it contributes half of the rotation of the scapular. That means total it is having 60 degrees of arc. So this axis causes 30 degrees of motion is taking place in this axis of rotation. Okay, so this is done here at this phase 1. Okay, and the elevation of the clavicle, here the elevation of the clavicle is also checked by this coracoclavicular ligament. So how it is going to check? The ligament becomes taut during the elevation. Up to that stage, this 30 degrees of scapular upward rotation is going to take place. Okay, through the initial upward rotation of the scapula that occurs with the clavicular elevation at the SC joint, the acromioclavicular joint maintains a relatively fixed relationship between the scapula and the clavicle. Here there is no upward rotation at the acromioclavicular joint. Although the coracoclavicular ligaments prevents the upward rotation of the scapula on the clavicle, but they permit some tipping, that is called as anterior tipping and the posterior tipping, like that. So they permit some tipping, and about 10 degrees of winging of the scapula will be taking place, which maintains the scapula against the changing the contour of the thoracic cage. So the thoracic cage, so the tipping is mainly occurred due to it has to maintain the contour on the thoracic cage. The scapula has to attach on the thoracic region. For that reason, some tipping is also taking place here. The tipping are taking place only at the acromioclavicular joint. So although it doesn't have any upward rotation, but it helps in the tipping of the scapula on the rib cage. When the costoclavicular ligament becomes taut and the clavicular elevation ends, the scapula will have upwardly rotated through an arc of 30 degrees only. Okay. So at that time, the humerus, how much humerus is going to elevate here is, so this is 30 degrees, the humerus is going to elevate 2 times greater than this thing. That means 60 degrees of glenohumeral joint elevation can be seen, whether it may be a flexion or abduction. So for example, if you take for abduction, so 30 degrees of scapular rotation helps in remaining 60 degrees of glenohumeral abduction. Totally 90 degrees of abduction is going to take place at this first phase. So at first phase, this is the thing is going to happen. In the second phase, so the remaining 30 degrees of a scapular rotation has to take place. So how this thing is going to happen means, this axis of rotation is going to shift laterally. So the axis of rotation, now here it is the axis of rotation. So this axis of rotation is going to shift laterally to complete the full range of scapular upward rotation. So that we can see in this pic. So here you can see, here the axis of rotation is going to be turn up to the lateral aspect. So as the axis is shifting to the lateral side, more lateral side, the range of motion of the scapula is gradually increasing. So from at this level, what is happening? So the range of scapular rotation is taking place at the up to 20 to 30 degrees. So here we will got the 30 degrees of motion. Here we got the 30 degrees of motion here. And the next range of motion is occurred after the shifting of the axis of rotation towards the lateral aspect. From here to here, from second point to third point of axis of rotation, so we will get the maximum range of 60 degrees of rotation. Now how it happens, now we will see. So as the trapezius and the serratus anterior continue to generate an upward rotatory force on the scapula, the scapular movement is still restrained by the conoid and the trapezoid ligaments at the acromioclavicular joint. And now by the costoclavicular ligament at the SC joint also. So here it is limiting the movements here. It is limiting the movements, that is the elevation of the sternoclavicular joint is limiting by this coracoclavicular ligament. But here the forces are continuing, that is the trapezius as well as the serratus anterior. So the serratus anterior forces as well as the trapezius forces are still increasing. So then what will happen here is, this upward rotatory force being created by the trapezius as well as the serratus muscles, the coracoid process of the scapula, pulls downwards and tugging on the coracoclavicular ligament, carrying the posteriorly located conoid tubercle of the clavicle downward as well. So the resulting motion is rotation of the clavicle. The resulting motion, because of all these changes which are taking place by the upward rotatory force of trapezius and the serratus anterior, causes rotation of the clavicle around its longitudinal axis. So we know that the rotation of the clavicle which is taking place in the longitudinal axis, which passes in between the joints of acromioclavicular joint as well as the sternoclavicular joint. So once the posterior rotation of the scapula taking place, here there is no movement or elevation of the acromion, elevation of the clavicle over the acromion will not take place, but this continuation motions, forces of all these muscles causes the posterior rotation of the clavicle, which causes the lateral end of the clavicle, that means the inferior aspect of the clavicle will come to the anterior aspect is taking place. So that is, the rotation will flip the lateral end of the crank shaped clavicle up without causing further elevation. So only rotation of the clavicle is taking place, but it is not causing any further elevation at the SC joint. So the scapula attached to the lateral end of the clavicle will be carried through an additional range of 30 degrees of upward rotation around an AP axis through the acromioclavicular joint. So this axis is the AP joint, which causes the further rotation for the remaining 30 degrees of upward rotation is taking place. So here the acromioclavicular joint undergoes maximum of 20 degrees of tipping and 40 degrees of winging is taking place. That is double that of in the phase 1. Okay, if 180 degrees is accepted as the maximum range of flexion and abduction of the humerus, raising the arm to the horizontal involves 60 degrees of glenohumeral motion and 30 degrees of scapulothoracic motion, with the scapular movement produced by clavicular elevation at the SC joint, and raising the arm from the horizontal to the vertical. So here, so the glenohumeral motion, for example, this is the glenoid cavity, and this is the humerus. Up to this horizontal abduction, that means 90 degrees of abduction, which causes 30 degrees of scapular rotation, which is taking place by the sternoclavicular joint elevation. Okay, and which causes totally 90 degrees of abduction. Out of 180 degrees of maximum range of elevation, this 90 degrees is taken up by this sternoclavicular elevation, whereas further raising of the arm from horizontal to the vertical position, it involves an additional 60 degrees of motion. That means another 30 degrees of scapular rotation is taking place by the posterior rotation of the clavicle at the acromioclavicular joint as axis of rotation. Okay, so these are the two phases. In the first phase, the movement is taking place at the SC joint with the elevation. In the second phase, the remaining 30 degrees of upward rotation of the scapula taking place by the posterior rotation of the clavicle. Okay, so these are the two phases which are taking place in the scapulohumeral rhythm to complete the rhythm in the ratio of scapula to the glenohumeral as 1:2 or glenohumeral to scapular thoracic as 2:1. Okay, so in this scapulohumeral rhythm, so up to 0 to 30 degrees of scapular rotation involves sternoclavicular joint, whereas the remaining 30 degrees involves the rotation of the clavicle, that is both the ends, both the sternoclavicular as well as the acromioclavicular joint helps in further 30 degrees of scapular rotation to complete the scapulohumeral rhythm. Okay, so the sequence of events that are part of the scapulohumeral rhythm occur regardless of the plane in which the arm is elevated. So in any plane, this is the rhythm is going to follow. Okay, whether it may be flexion or it may be abduction. So one difference you have to note in this thing is, during abduction in the frontal plane requires concomitant lateral rotation of the humerus to clear off the greater tubercle, to complete the range of motion of the humerus. Okay, so these are the things happened during the scapulohumeral rhythm in part 2. So in the next session we are going to see upward rotators of the scapula. Thank you.